Today we're going to be talking about spine
issues.
Okay.
Yeah. Issues.
So maybe we can start off with what kind of spine issues you commonly see. So from your side?
From my side first. Okay. So usually we would see more of management of these spine issues.
Mm-hmm.
So management of pain for, let's say, people with scoliosis.
Okay.
Yeah. Some pinched nerve due to herniated discs or tight muscles.
Okay.
And also, we also see sciatica issues as well.
Right. Okay.
Yeah. So these are some of the issues that people normally come to us.
Okay. So I guess there's quite an overlap in the stuff that we see as I see as well as you.
Yeah.
So so the spondylosis or the wear and tear in the back is very common as we're all getting older and everything. But often in the athletic population as well. So you'll have acute sort of flare up. So it could be from doing a deadlift or a squat, and then you get a tear to the disc. Depending on where that tear is located, it can cause pain when you're just sitting or axial pain. It could be the disc herniates out a little bit and then causes the pinched nerve like you talked about. And a lot of the time, because of the inflammation and the pain, then you get the muscle spasms and everything as well. So I guess actually, although we're looking at it from maybe slightly different perspective in that I'm more concerned, but I'm thinking about the underlying problem, but you're also dealing with the symptoms that I'm thinking about. Yeah. How often do you see back pain? Do you see a lot of it?
Actually, we do.
Yeah.
More so because recently a lot of people have started to exercise again. Yeah, and another thing is also because people are sitting a lot due to like work, and especially previously when during COVID times, they actually sit at home more instead of like the office with like good chairs and then the height of the table. So it does affect a lot on the neck and the back as well.
Yeah, and I guess also using like smart devices.
Yes,
right?
Especially when they're always looking down.
Right, on the. So for all of you who are watching this, if anyone's watching it at all, then make sure your device is up like this rather than down like that, because you're putting a lot of tension and everything on it. Actually, I've got this kind of new kind of thought process about back pain as well. In that, for a lot of times we focus on joints, the facet joints and the disc and so on. But in fact, I was doing one of my little videos about it as well. You may have seen them; they're kind of funny. But one of the things that we forget about are the ligaments on this.
Oh yeah.
And the reason for that is these are the kind of supporting structures around the bones and the discs and everything. And if these aren't working well, what will naturally happen is those muscles that are originally intended there for movement suddenly have to do postural things as well. And I've got this little giraffe, so don't laugh, but this is basically my little example of how it works. So if you imagine these are the elements in the back, like the discs and everything, and the string is the ligaments. So when things are working well, you can move it and the muscles are happy and so on. But when you don't, it kind of goes like that.
Wow. And
so then what happens is the muscles go into spasm, and then it's having to do the movement as well as the posture. So I think, in terms of what kind of spine issues we see and everything, I think we see all the kind of disc and the joint and things like that. But I think the ligaments are really play a bigger part, and we really appreciate and give them credit for.
So what cure methods do you usually do, like treatment methods for patients?
Well, as with I think my general advice to patients is there's a broad spectrum of things what you can do, the way you can approach things. So first and foremost, you can do nothing at all and just see what happens, And oftentimes with back pain, things will get better over a few weeks, maybe 6 to 8 weeks, and sometimes when patients are seen in public institutions where there's issues with accessibility and wait times and things, often it was a case that by the time they come and see me, symptoms have improved. right? And that's good and bad. I mean, it's good in the sense that great. I'm happy that you're stepping up and doing better. But on the other hand, we haven't really addressed any of the underlying issues.
Right. The root causes.
Correct. And then at the other sort of extreme end, like, so one end is to do nothing at all. The other extreme end is to kind of go down more interventional, surgical type treatments. And not everybody quite needs that. Of course, it has its place, and it's very important that you do adopt it. And then in between, there's this whole kind of plethora of different options. So, doing physiotherapy, maybe doing injections for the back, coming and seeing you guys for treatments and so on. So it depends really on what the underlying problem is. And thereafter, you kind of have to you have to personalize it to the individual patient as well as the problem that they're having. Yeah. So I guess, there isn't a one rule fits everyone.
One size fits all.
Yeah, one size fits all. Sorry, one size fits all. But it could be that it's a physiotherapy plus PRP injection, or maybe steroids appropriate, or whatever. And in between all of that, I will often refer for acupuncture. So So what's the kind of thought process when somebody comes in with a back pain? How do you sort of go about like assessing them for treatment? Where do you know where to
treat them?
Yeah.
So usually for pain in general, we have two different types of pain. We would actually see this. So that means I'm not sure what you can see. One is 不通则痛, means like if there's a blockage, then there will be pain.
Okay.
The second one is if there's not enough nourishment, there will be pain as well.
Okay.
So usually for a blockage ones, those are more like pains that are more acute.
Okay.
Yeah, more painful, like sharp pain, those kind of pains. For the second type, which is nourishment, then those kind of pains are more dull, more chronic.
And what's the blockage that you're calling? Like blood flow?
Yes.
Or? Okay.
So blockage is like you see there's a lot of like blood clot, a lot of like dampness.
Oh, okay.
Yeah, those kind of blockages. The qi doesn't flow as well.
Right.
Yeah, so it does sort of like block the blood circulation in a way.
And this is an acute sort of
Yes,
pain.
more acute pain. The pains that are more acute, more sharp, more localized.
Okay.
Yeah, so those kind of pain we actually do acupuncture more on the foot itself.
Right.
Yeah, so that it can actually help to diffuse the pain as well. Because acupuncture actually causes it causes microinjury. So once there's like a microinjury, there's more blood circulation there, which is what we need, right? So more blood circulation, more good blood, more oxygen, and then it can actually help to facilitate healing and therefore relieve the pain.
And so I guess on the flip side of that is when patients have chronic pain, it's because it's stagnated for such a long time.
Yes, correct.
Then you're not getting the nourishment
Correct.
side.
Yeah, so like you see, compared to this area here, there's a lot of like blood cells and everything. This part is because there's not enough blood flow. There for a long period of time. Therefore, you actually have a lot of pain, like chronic, dull, achy sensation.
And what sort of always, in Western medicine, and for some insurance companies, there's this kind of time frame of it has to be 3 months to say it's chronic. And can you start developing these things earlier?
Actually, yes. Yeah, for example, people, usually in this case, people, let's say, for example, they sit very long on the desk, they're chained to the desk.
Okay.
So they actually do start seeing signs of back pain. Yeah, but they don't treat it.
It's kind of like grumbling along.
Yes, and then the things like, it's because of posture. So once I actually improve it, which they actually don't most of the time, then it actually stops, becomes longer and longer and longer. They drag it out, and therefore becoming this very dull, achy sensation which don't go away.
And I guess it's quite common, right? Like a lot of us do sit around, even for me, in clinic, I'm sitting around a lot of times a day, and often you're not mindful of posture, and you're not mindful of. And then also your hip flexors get tight, and then, so
and people don't exercise as well. They do not move around. They do not train their core muscles, their back muscles. Therefore, actually,
so it's a cumulative thing. But would you in addition to, let's say, treating the trigger points or the muscle tightness and improving the flow and
Yeah.
etc. Would you address other areas like if it was hip flexors or quads or
Yeah. So actually, that is also how important Western doctors are to us as well. Yeah, because they actually do most of the checks. So
Right.
yeah, we do some checks, but of course they're not as thorough as what you guys do.
Okay.
Yeah. So in that case, when people actually bring on their reports to us,
Oh.
then we actually know more what where we can target as well.
Right.
Yeah, if it's like on the spinal issue
Yeah.
or muscle issue. Yeah, so in that case, we sometimes do different techniques. Yeah, we do not actually only do points on like certain areas. We do have some points that actually do help with like back pain or knee injuries, that kind of thing, like some specific points that we
Yeah.
use. But we also do other points that actually.
And there's the whole thing with the meridians and
Yes,
everything as well,
correct.
right? So
Previously, your life in physician mentor as well. Actually, did manage to talk about the meridians.
yeah. So there's all that, and quite often I've heard that for back pain you might go for that hand as well.
correct. Yeah. So, because the meridian channels are actually very widespread in the body, it doesn't mean that one point on the extension of your body actually does help with the like back, for example, or the knee, that kind of thing.
Okay. So let's talk about this case that I had lately. So this patient had it was very interesting because she had pain in many different areas in the back. It wasn't just central to the spine. It was in the neck as well as around the shoulder, and then it was kind of lower back as well, and then around the pelvis and the sacroiliac joints and things. And so for her, I because this has been going on for a while, I opted to do PRP index. So I did for the facet joints and then trigger points and then SI joints and the lumbar facet joints. So there was a significant improvement. However, the one that remained and that was troubling was the trigger point here in the trapezius. Now, I suspect, part of it is it could have been a little bit early to follow up, and maybe the PRP does take some more time, and it is very effective. And all the patients I've done with PRP for the lumbar or for the back have had significant improvements from the pain. But in that situation, let's say it's the hair, do you think acupuncture might have been appropriate for that?
Actually, that does help. But we do see sometimes after a few sessions, they still do have a lot of tightness over here. In that case, we actually do try to encourage them to try cupping and stuff.
Oh, okay.
Yeah, because cupping actually can relieve a lot of tension in the neck also.
How does that work? What does it do?
So the same thing, cupping actually helps to improve the blood circulation because of the suction force.
Okay.
We will cup the glass cup on the back itself.
Yeah.
And then the suction actually causes a little micro breakage to
Okay, like micro tear.
Yes,
Oh.
correct. So in that case, it actually helps to facilitate the healing.
Is there a difference? I've seen some cupping done with you have to pump it, and then some with the fire.
Yeah.
Is there a difference?
The fire we like to. Sometimes we actually do prefer them because there's a little bit of heat element. So in TCM, heat actually does improve the blood circulation even more. So it does have that kind of additional improvement right there.
In the flow. But is that? I mean, without sounding condescending or anything like that, is it harmful? Like the heat?
The heat, sometimes if you're not done properly,
Okay.
yeah, sometimes it is.
Seeing somebody who's experienced
Yes,
it.
correct. Yeah, because sometimes the heat might actually be too hot and it cause a little bit of burning.
Right.
Yeah, and then sometimes if you leave the cups on too long, you might have a little bit of blisters as well. Yeah, so you just have to make sure that you see a professional person who knows how to do this cupping well. Yeah, and make sure not to leave the cups on for too long. And then also that the heat-wise, they have to make sure that you don't burn the patient as well.
And typically, how long do you leave the cup?
Typically, 5 minutes,
5
5 to 10 minutes. Yeah.
So let's say this patient who I did the PRP for, right, and he's got significant improvement in most areas except this. What would be the kind of expected progression for her? I mean, given the fact that, majority of the pain has settled down. Like, it's very chronic sort of symptoms. How many sessions would you normally can do before you start to reevaluate and
Feed.
yeah.
Usually in this case, especially if it's a chronic situation, we would tend to say at least 3 to 5 sessions.
Okay.
Yeah, 3 to 5 sessions. Then you should be able to actually see a very, very, very quick development. The best is actually 2 times a week.
Right.
Yeah,
Okay.
because the effects do wear off after a while. Yeah, so
So you want a kind of cumulative
yes,
sort of thing.
correct.
Oh, okay. I guess it's a bit like with PRP. Sometimes, for the guidelines say that to optimize thing, you do, say for the knee, you do 1 injection once a month, and you do between 2 to 4 and so on. So like you're kind of trying to build up on,
Yes, correct.
on it each time with the thing.
Yeah.
Wow. Would you ever combine the cupping with other TCM modalities as well?
The other TCM modalities.
Like, would you do just the cupping in isolation? Or?
Sometimes yes. Sometimes yes, especially if it's not very serious. But then we will actually turn to recommend doing acupuncture together.
Okay.
But sometimes some people are a little bit iffy about acupuncture because of the needle.
Of course, yeah.
Yeah, so then they will actually tend to like to do a cupping more.
Right.
Yeah, because it's actually quite relaxing. Have you done cupping before?
No, I'm tempted to try it now that
Yes.
we've been talking about
Yeah,
it. so-
actually, personally, I do prefer cupping.
Really?
Yeah, because it does relieve the pain. I mean, during the process itself, it might be a bit painful because of the suction.
Okay.
And then also sometimes you drag the cups.
Right,
So
yes,
sometimes
yes.
you do see a lot of one whole line of numbness, right?
Yeah.
Yeah.
But afterwards, it feels
Yeah. It's like first you feel the pain and then after
Okay.
you feel the relief.
no pain
Yeah.
again.
Yes, no pain, no cure.
Fair enough.
Yeah.
So I mean, if let's say, I guess it's everything is like a combined approach. So there would be situations where, for me, like let's say this patient that I had, right? So where I've improved 80-90% of the symptoms in different regions, but there's that 5 to 10% or maybe 10 to 15%, which is residual. In that sort of situation, it might be useful to go for that sort of combined approach, I think, right?
But yeah, of course, like for us as well, sometimes we do see patients who still do not feel, they do have like residual
Yeah,
pain,
yeah.
even after doing a lot of acupuncture,
Yeah.
a lot of cupping. In those kind of cases, we would tend to recommend them to come over to like Western clinics to actually really get it checked out
Yeah.
to see what else is there that might be hindering the healing process.
Yeah, and honestly, like I think this whole, my change in mindset, and I think hopefully, if there's any other clinicians listening to this, that focusing on the ligaments is very useful because, there's very few things in the back that we can try and focus the treatment on to stimulate it to heal up.
Yes.
Okay, so let's say we have a disc or something like that. Quite often, you do a cautery of it to try and shrink it and so on, but you're not really stimulating it to heal. So with the ligaments, I mean, with the PRP and other treatments akin like prolotherapy as well, what you're doing is you're trying to stimulate those areas to heal up, and that's the whole idea of, I don't know if you've come across it before, regenerative medicine. Oh, so it's like this new. Not new, it's been around for a long time, but it's really where you're bringing that kind of basic science research into medicine. You're trying to use those tools to stimulate areas to heal down and try and almost slow down that wear and tear process a bit.
So the regeneration.
Yeah. So I think combine, from that aspect doing that, from the TCM aspect dealing with this kind of symptomatology, I think it's very, very useful, right? Yeah. Fair enough. So I guess in some ways that's really how it sort of complements each other, right?
Right.
I
think like from what you said about like how the healing process and everything, I think that is also what TCM is about as well.
Aiming to achieve.
Yeah, it's more like helping the body to heal on its own. Therefore, it's gonna take a while, definitely. But I guess if Western medicine does come up with something that actually can speed up the process, I think eventually it's the patients that are like benefiting from it.
Yeah, I mean, I remember some time ago with Amanda and another colleague from TCL looking at sort of ultrasound guided acupuncture and things like that. Just so you can see the twitch and everything like that.
Yes.
It's quite exciting and maybe something that some
There's so much
to
you can
explore in the
Yes,
future.
great.
But yeah. Well, I think that probably covers a lot of the stuff that we were going to
Yeah,
talk
great.
about regarding back pain. I don't know if anyone has posted any questions, but if you do and you want to reach out to us, by all means, please do so. But I'd like to thank you for coming and joining us.
Thank you so much.
And you know, I hope we can do something else in the future. Yeah. Yeah. If there's any topics that anyone has in mind, do let us know.
Awesome.
And yeah, well, thank you very much for me. And